Okay.
Thanks very much, Carol. It's a pleasure to be here today and have the chance to speak with all of your membership. And thanks all of you for your attention today. So Pat and I are going to talk to you about EHR certification, and you do have some options. So the core of our presentation is going to say what is the right course for you and helping you chart that. In terms of certification, the most efficient model is really the commercial or vendor certification. That is where you would take and review a piece of software and then go and install it, an exact copy or replica of that software in many different sites, right? That's obviously the most efficient way to do certification. But there are some nuances in the HITECH Act for hospitals and eligible providers. Specifically, the pace that all of this work and activity has to happen is very, very fast. And it also, the regulation as it's written, makes some assumptions that would keep that commercial or vendor model and make it a little bit more awkward. Specifically, many hospitals are way down the road in installing and implementing EHR technology, many years and dollars invested already, and they're not in the position where they can just start from the beginning and go and pick a new product off the shelf and install it. So they need a fix, they need a rescue, a way to work around and meet those requirements if they hope to qualify for the incentives. So that, when I say what's the right course for you, Pat and I will talk with you about some of your options and review that. So let's just spend a moment looking at the agenda of our time today. I am going to give you just a little bit of background on CCHIT, the organization, and who we are, and other things that we do. We're going to zero in on the ONC ATCB certification, the federal government program that's the must-have to qualify for those federal meaningful use incentives. Then we're going to go more into the EACH program, which is the EHR alternative certification for healthcare providers. Now, keep in mind, that's the government program, but with some special upfront help and education to help hospitals certify their implementation of particular technology. Pat will pick up there and go on to that. We'll spend some time helping you through a little bit of a decision tree to know the scenarios where each might be most helpful for you, or if you can more easily rely on that vendor model of certification. And finally, we're going to save a lot of time for your questions at the end because we know that's really valuable. So here's the slide that's a little bit of background on CCHIT, the organization. We were founded in 2004, and shortly after that, we were awarded a multi-year contract by HHS and the very new, at that time, startup ONC to develop certification programs and criteria and testing methodologies for EHR software. We began conducting our first certifications in 2006. The point here is we have a lot of years, and we've really done pioneering work in understanding how to evaluate EHRs, how to understand how to evaluate EHR software in a number of areas, ambulatory EHRs, inpatient, and also some of the nuances around specialty EHRs, emergency department, child health, LTPAC, et cetera. Those were all programs that we have developed ourselves and launched over the years. We've certified hundreds under our CCHIT branded programs, and then since fall of 2010, that's when the government's new program, right, all of this for meaningful use and the ONC ATCBs, that's an authorized testing and certification body, we received that status from HHS this fall, and we've stayed busy. We've certified over 250 products to date under that particular program as well. And most recently, we're about 8 weeks into our launch of EACH, again, the alternative to help qualify for those federal incentives. The next slide compares and contrasts the two programs. As I mentioned, the government program is the must-have if you wish to qualify for those federal incentives, and it's really the meaningful, the minimum level of criteria that you need to meet there. We continue to operate as a completely separate program, the CCHIT certified programs. Those you see listed in blue on the left. The nature of that certification, it's voluntary, it's a very robust, comprehensive certification. And again, contrast that to, on the right, the federal program, which is more of a minimum government standards to qualify for the money. A real key area of difference between these two programs is the source of how the criteria and testing tools were developed. CCHIT has used panels of volunteer stakeholders that work to draft the criteria. The criteria are vetted through multiple cycles of public comment. They're pilot tested. It takes 12 to 18 months to develop the criteria, the test scripts, and again, those are created by providers and subject matter experts in the field who are talking about what they'd really like to see in the EHR. For the federal government program, they create the criteria and the test tools. ONC creates the criteria themselves, and then NIST, the National Institute of Standard and Technology, creates the testing tools. And in terms of the providers who are covered or served by these two different programs, for the government program, it addresses the Medicare and Medicaid eligible providers in hospitals, really just for the purpose of seeking those incentive payments. For the CCHIT program, I mentioned the different domains, ambulatory, inpatient, LT-PAC, but it gives providers a greater level of assurance when they're investing in the EHRs, and there are options geared to the needs of specialty providers as well that are add-ons to the domains that we've developed. The CCHIT program tests the comprehensive EHR, and it tests the integration of the different models. We verify that the product is not vaporware, it's actually in use at multiple live sites. For our ambulatory programs, we actually have some usability ratings, a 5-star rating, and over 60 products have been through this testing, and it's reported on our web. We also give just some vendor demographics or characteristics, so there's a little bit more information about the products and the company that's offering them. The government program, in contrast, it's designed to be highly flexible. So it's a modular program. It's the most flexible program. You can have a complete EHR tested, or you can have just modules and assemble them yourselves. It doesn't test the integration, but it is designed to encourage innovation and allow a lot of flexibility for providers to assemble solutions that might work for them. The CCHIT program is really most accountable to the providers. It's helping them limit or assuage risk. The government program, in addition to being accountable to providers, it's serving a purpose to protect payers and public funds, the taxpayers' money that are being offered through these incentives. In terms of overall goals, the CCHIT program gives assurance of the functionality, interoperability, and security that providers need, and a really transparent testing process. They should be good for the long haul to take care of patients with this program. And in terms of goals of the government program, it's there to qualify for the meaningful use incentives and also the purposes of the high-tech law to improve outcomes of care and really support longer-term health reform. So that helps you understand we offer two programs. The rest of this presentation will really focus more on the government, the ONC ATCB certification program that's necessary to qualify for those meaningful use incentives. On this slide, I use it in all my presentations, and it's somewhat straightforward, but we find that there's a lot of confusion, a lot of questions, and people, it's a natural tendency, they seem to sort of lump step one and step two together. But when you're thinking through the rest of the things that Pat and I will talk about today, keep in mind that the role CCHIT can play is really just with helping verify that the technology is certified. Step one in the road towards getting these incentives is you must adopt and install certified EHR technology. And that technology has to be checked out or certified by an ONC authorized testing body. It has to be checked out against the ONC developed criteria, and the methods to do that, it has to be the NIST test procedures. Okay, so that's the role we can play with you today. The next step is how you actually use that technology. You'll amass and collect some data, and then you'll report on a separate set of metrics that are defined as the meaningful use goals or measures. Okay, so that's the technology is separate from the use in the collecting data and reporting on those metrics. And then step 3 is getting all of your information together, your different rates for the different metrics, verification of your certified technology, et cetera, and going through the correct format through CMS to apply for and receive your payments. So just keep that in mind, the piece we can help with today. There's another piece of terminology that I'd like to review with you, some federal definitions in the regulation to understand more options about certified technology. One is, what is a complete EHR, and what is an EHR module? Well, a complete EHR is just quite simply one that can meet all of the government criteria. It's able to perform, at a minimum, all of the applicable capabilities that are required. Essentially, it addresses every single one of the criteria. A module, on the other hand, is at a minimum a product or component that just meets at a minimum one of the certification criterion. It may meet more of them, but it's something less than addressing every single one, which is the definition of complete. So we'll use these definitions in our discussion later on. If you wish to find out more about the ONC criteria and the test procedures, we've given you some hot links here. You can go right to the source where they're developed, the ONC website. You can link to their standards and certification criteria and see the absolute criteria right there. If you're thinking of getting either your vendor technology, or if you're a hospital or EP, having your site certified, you should really go look at these criteria right away and get an idea of what's required. The second site you can go to is you can see the in their rawest form, the NIST test procedures. So that's the test that the technology would have to pass to actually get certified status. And again, there's a hot link here to the NIST website. So here we're showing all of the 2011-2012 hospital criteria that are currently required for the Stage 1 incentives. If you have them all checked, right, that's a complete EHR, or you may be able to assemble different modules, again, to eventually get them all checked with different formats. But again, this sort of orange star here, this is an interpretation from CMS and ONC. The hospital, you actually must possess certified technology to meet every single one of these criteria if you wish to qualify for the incentives. So don't get hung up on if you're core or menu. To be really clear, you have to have technology that addresses all of these criteria, okay, regardless of what you are actually reporting in terms of core or menu that year. That's something that we get a lot of questions on as well. So where can you find, if you're a provider and you wish to find more information about results of technology, what's been certified and what's not? You can go to the ONC Certified Health IT Products List. They call that the CHAPL. They have an acronym for it. It's a web page, again, a hot link here. And that's just simply the complete list of all the EHRs, both complete and modular, that have been tested by one of the ATCBs and passed, and they're all right there in the official source. If you're a provider, you may use this website a little bit differently. You can combine different modules, as I mentioned, using the CHAPL to validate. You can do a lookup and validate whether your different vendor technologies are all certified and if they assemble enough to meet the definition of having a complete EHR. And the CHAPL will help you generate an ID number that you would use in your CMS application. I think Carol's going to have a future session for you all on that process and how to do it, but the CHAPL is certainly a source of information that you would use in that process. Another place you can find certification results is CCHIT's own website. We have something called a Find Products webpage, and this shows the products that have been inspected by us. And there are over 250 of the government program and others through our CCHIT program, many listed there as well. And this website is just an aggregate cross-indexed product listing, and you can do a faceted search. You can pick different attributes out that are most important to you about the technology and find products that meet your needs that way. And then also on our website, we have individual product pages for each of the different vendor products, and that includes all the ONC reporting requirements as well. So these are two very useful websites for you in finding more about what products that have been certified. Okay, now we're going to get more into the EACH program, the Alternative Certification for Healthcare Providers. And this is where I'd like to turn it over to Pat Becker to pick things up from here. And Carol, you can either, there you go, turn the presentation over to Pat. Thanks, everyone.
Okay. Thank you very much, Lisa. Good afternoon, everyone. This is Pat Becker, and I'm going to go over the Alternative Certification for Healthcare Providers, or what we call the EACH program. The reason we created this program is we realized fairly early on that there were some limitations to the vendor certification models. Most hospitals are fairly complex, and they rarely deploy just one vendor's solution. Some hospitals, have an interconnected system of systems, all of which may not be certified. We have found also that, particularly in large hospitals, there can be a mix of commercial and self-developed software. So we've created the EACH program to help with this. As Lisa said, if for some reason you do not possess a vendor-certified technology for each of the meaningful use criteria, then the EACH program is there to assist you. So again, the certification alternatives are if you have self-developed technology, or if you have older vendor technology which the vendor has chosen not to get certified, but you believe that it still meets all of the criteria, or you're trying to fill a gap and do a modular certification where you'll have some certified and some uncertified EHR technologies. Again, then the EACH program is available for you. However, if you do have certified technology, whether you're combining vendor technology or you have a complete EHR, as long as each module has been certified, then you would not need the EACH program. And we're going to go over a few scenarios to help explain that a little bit later. So how do you know if you need EACH? Again, the first thing you should do is check whether or not you're even eligible to receive incentive payments. And there are a couple of websites here that will help you go through whether or not your organization is eligible. There are some specific rules from Medicare and Medicaid around the incentive program, and you need to reach at least a certain threshold in order to be eligible. So that's the first thing to check. Once you assume you are eligible, the process is first you need to have certified technologies in each of the meaningful use criteria. Once you have those certified technologies, you retrieve a CMS identifier from the ONC, and then you register to participate in the EHR incentive programs. And Carol said earlier in today's agenda that they're going to have a presentation on the last step of this, I believe later this month yet. So here's some examples of when you might consider using the EACH program. If you have a single uncertified system, whether it's self-developed or a vendor purchase product that perhaps you have modified or that the vendor hasn't taken to certification for whatever reason. If you have a mix of systems, some of those may be certified and others not certified, then you would bring the modules that aren't certified through the EACH program. Or if you have many sites with a number of different systems, some of which are certified and some of which aren't, again, you would bring those forward to the certification process. So, and this is probably the most straightforward scenario, which is that you have a self-developed complete EHR. There's something between 10 to 15% of hospital organizations where this is the case. And we've had several of those come through the EACH program at this point. Let's say you have a mix of systems, some certified and some not. In the top scenario here, you see there's a vendor product with a certified technology. That doesn't need to come through the EACH program. However, then if you have some self-developed technology that meets some of the criteria 302C and D, then you would bring those through the EACH program and you would get a CMS ID for those particular items. This is actually probably the most complicated scenario, but it's actually one that we've seen a number of times already. In the first case, an organization has 3 different types of technology. They have some self-developed technology, which is shown in the red here. They have some uncertified vendor technology. And then they have some certified modular EHR technology. So in this case, they would bring the red and the yellow through the EACH program to create a complete set of criteria that's certified. In the second scenario, again, they have some vendor-certified technology represented in the green. Then they have some self-developed technology represented by the gray, and then they have also some other self-developed technology, which they're calling My EHR. So in this case, they would bring the gray and the red through the EACH program, combine that up on the CMS site, and create their CMS ID. In the third scenario, they actually have 3 different kinds of uncertified technology. In a lot of ways, this ends up becoming a complete EHR for them because they have no vendor-certified technology. So they would end up bringing all 3 of these components through for certification through the EACH program. Now let me take you through the EACH process. We've tried to create the process and we've put it into 3 stages, which we call preparation, readiness, and certification. In the preparation phase, you go through an online orientation program that actually talks to you about what it means to go through the entire process, but it's at a very high level. And it's to help you or the organization determine whether or not they actually need the EACH program. It introduces the EACH online community. We have one for hospitals and we'll soon have one for eligible providers. And it talks about the team that you're going to need to put into place in order to do self-certification. What we have found to date is that organizations often need between 3 to 5 people on the team that will take them to certification. So they may need a security expert. They usually need some kind of a project management person, and then they may need an analyst or 2 to really understand how the software is used within the organization. The second phase then is the readiness assessment. Again, we have an online tool that takes you through the readiness. We ask you to identify the systems that you will be bringing for certification. We call this the inventory. We look at those systems, and then you determine which criteria each of those systems is going to cover. And through this process, you can determine if you have any gaps between the systems and the criteria. And then if you do have gaps, you have options of either going out and purchasing software to meet that criteria or doing some additional development. And then the end of the readiness phase is another online course, which we call the certification course, which takes you through what it is going to actually do to reach certification, as well as talks to you about what's involved in the testing of each of the criteria. We have test scripts available for you. These are obviously based on the NIST test procedures, but we've outlined them in what we think is a more user-friendly way and to guide you through them. And we've also created a group of frequently asked questions and an interoperability guide that are there to help you. We also have weekly webinars for those that are participating in the program. And then we ask you to test each of the criteria that you're going to bring to certification at least twice, and to give us timings on those tests. We then use that, once you've completed the tests for each of the criteria, we then use that sort of as a gut check to decide whether we think you're ready for actually going to certification. So depending on the timings, based on our experience, we have a good feel for what it should take you to do to perform each of the tests. And once we have those timings in place, we will have a phone discussion with you to help you prepare for certification. The final phase then is the actual certification process. We schedule an inspection with you when you've prepared an application. This is done using virtual web technology, much like we're doing today. And we test the ONC criteria using the NIST test procedures. The certification results are then reported to ONC, and they will be listed on the ONC website as well as on the CCHIT website. Our goal, obviously, is to have you pass that certification test the first time, and that's why we've created the EACH program to help you be successful in doing that. We do have retests available if you need them, but we're hopefully that won't be necessary. So I'm going to go through a few screenshots of the actual EACH website. This is the preparation area, and in the lower right-hand corner is the first screen of the learning course that I talked about, which we call the preparation course. It takes about 20 minutes. We do require that at least one person from each organization go through the program. Once one person has gone through the program, anyone else in the organization is eligible to go ahead and use it at no additional cost. But in order to move forward, we only request that one person within the organization go through it. Once you've gone through that and you've decided that the EACH program is the right program for you, then the second learning program is a second online course that takes you through the actual website and how to fill out the various components. As I said earlier, we have a number of online resources that are available to you. We have frequently asked questions. We have the learning courses. And then we have something that we call our CCHIT toolkit, which has a lot of information about the test scripts and the appropriate way to go through those. We also have an online community where organizations can share information with one another about how they've managed to prepare for the inspection. And we also have weekly webinars where any question that anyone has will be addressed in that webinar for the entire community. Then in the readiness phase, you will pick which criteria you're going to seek certification for. As you can see, in this case, the organization, these are the security criteria that we have listed here. And even if you're bringing only one criteria for certification, we are required by ONC to inspect security for every module that's brought forward. So if you bring a group of criteria together for inspection, we test the security. But if you only bring one criteria, we still need to test the security. If you're going to bring a complete EHR, then obviously all of these items would be checked, including the security items. Your goal, obviously, is to have, at some point, all of these boxes checked for your organization, whether you do that through each or not. Then when you get to the next part of readiness, you create an inventory, and you have the option of selecting certified technology, and that's just to help you make sure you have all your gaps filled. Vendor uncertified technology, we will try to fill in as much as we know about that vendor if we know anything, and then finally you can pick self-developed technology. Then you build a plan, and you can see in this case the green means that you have a technology and you want to bring it for certification. The yellow is the items that you still need to work. You need to pick technologies that will fill that meaningful use criteria. Red means you've not selected any technology that's capable of selecting that, so that's a gap that you would want to try to bring forward or find some technology to fill. So what we want you to do then, after you have technology for each of the criteria, this is the area where we ask you to put in the timings. So you can see here we have 2 spots where you can put in timings. We ask that you, excuse me, test each of the criteria at least twice and let us know what those timings were. The green here means that you've done that, and the red means you still need to do that. In the case of, we also at this point ask you to identify the staff that will actually perform that test when you come to the inspection phase. And then finally, you will get to the certification phase. There'll be a CCHIT tester that will work with you and your team following the test scripts and have you demonstrate your EHR technology over a virtual audio web conference. And then the end result is certification. We will report that to the ONC chapel, and from there you'll be able to obtain a CMS EHR certification ID. I don't know how many of you have been out to see this, but you can only get that ID when you've indicated in your shopping basket that you have technology that meet all of the criteria, whether it's the hospital or EP side. So in summary, CCHIT is an ONC ATCB certification body for 2011-2012. We have immediate capacity for testing, and we're offering the EACH program as an alternative for hospitals that do not have certified vendor technology. We will expand EACH to eligible provider in mid-April, and we're well on target and expect to fully meet that date. So with that, we'll open it up to questions.
Yeah, no surprise. I've got some questions coming in, and we've got about 20 minutes, which is great. So questions are coming in, and if you want to use the chat box to send me a question or the Q&A, you can do so, but I'm going to start with the ones that we've already gotten if that works for you. And maybe we can just tag team it here. First question, a couple people have asked how long the certification process generally takes.
Do you want me to take that one, Pat?
Sure.
So the test itself, we found that if you are testing against, say, a complete EHR and all the criteria, that could go between 5 and 8 hours on a single day. Some of the modules, and keep in mind that you have to test security too, even if you test modules. Some of the modules are, just a half an hour or something. So if you're getting just a few gaps filled, it would be a partial day of testing. But that's really an incomplete answer in terms of how long it takes. The testing, that's the testing itself. The preparation is really where you invest more of your time and your cycles of energy, practicing, reviewing the criteria, practicing the scripts, using the web-based EACH tools to do your inventory of which systems meet each of the different criteria. And that's where it can take more time. What we found is some hospitals get started, they've done some of this, and they can get through that part in a couple weeks, but others get into that. They do some research, they realize that they need to go back and perhaps make some adjustments to some of the technology. So you can see how they could sort of stay in that zone or area longer. So
sure.
The real answer is it really depends.
It depends.
Yeah, on your unique configuration. Pat, anything you would add to that?
No, I think what we find is that when it comes to the quality measures and to the security criteria, that's where people have the most difficulty because we are required to follow the NIST test procedures exactly as they are written. We don't really have a lot of leeway there. So once people start looking at what's required there, sometimes they have some additional work they need to do before they can actually get it certified.
Next question, can each program be used for a patient registry developed and used by a physician organization?
We're going to have the EACH for eligible provider available in mid-April. We expect to actually go live April 18th.
Okay. Right time for attestation. Let's see here. HIS vendor is certified, and so is the EDIS vendor. Does the hospital have to certify the use of both as used in its facility?
I think what the hospital needs to do is to make sure that it has certified technology for each of the criteria on that menu list. And so one way to check that would be to go out to the ONC website and pick the two vendors that you're talking about, and as long as they meet all of those items across the top, and those are the actual technologies that you're going to use when you do your meaningful use measurements, then you would be fine.
All right.
I think I answered that question.
Yeah.
If they want to make a more clarifying question, I'd be happy to try that.
Yeah, and I think also we've got both your email addresses available on this slide, so
sure.
Certainly they should reach out to you directly. Let's see here. How about getting a reporting system certified? We have an Oracle-based data warehouse that will do the ME reporting for a variety of certified systems. Which method would I use for this?
If you're a hospital, you can use the EACH program for that. We do have actually right now a couple of organizations that are coming through to certify their data warehouse. Remember, though, you have to also certify the security around that data warehouse as part of getting it certified.
That kind of leads to one of the questions that we got from a couple different people, which is basically the specific requirement for HIPAA-compliant software and what level of encryption is required.
It's in the NIST test procedures. I believe it's the encryption level 1. But if you go out to the NIST test sites, it specifies right there.
It's listed there, and that link is actually in the PowerPoint.
That's embedded in the PowerPoint.
Right. And we're going to make that PowerPoint available afterwards with the recording, so you can go back and find that link for the couple of people that asked that question. Let's see here. Can you explain the difference between the complete EHR certification versus the partial that was shown a few slides back? That was a few slides back, actually. Complete versus partial.
Okay, so let me go back maybe to that slide. It might help.
There it is. Oh.
This is it probably. So in these three scenarios, the first two in particular, you have a vendor a modular certification for some criteria. That's what the green pieces of the pie are. So that's certified vendor technology. And the vendor can be certified from anywhere from one to all of the criteria, right? So, but you're using that vendor certified technology. And then the yellow and red slide in the first scenario is technology you bring forward for certification. And then the second slide, it's the gray and the red. And they're just two different pieces of technology that you have within your organization. The yellow is to represent vendor uncertified technology. And then the gray is to represent self-developed technology. So that's the difference between them. The bottom scenario here really is a complete EHR that you're bringing for certification. It just has different components to it, and where they originated from. That's all that's trying to represent.
Yeah, right. A visual. Yeah. Let's see here. We have a certified complete EHR installed, but we use other uncertified technology to report quality measures. Can I rely on the certified technology for my application, or do I need to certify the additional technology too?
Okay, that's a very interesting question.
That's a great question.
As it stands right now, in order to, if you have a complete EHR from a vendor, in order to use any of that as certified technology, you need to possess all of the components that vendor brought forward for certification. And if you have all those components, then you may use it. If you're using a different piece of software for your quality measures, that software needs to be certified. The only way you could use the vendor's certified quality measures software is, in fact, if that's what you're using to report your quality measures.
And and that is a great question. I would imagine that I've got a couple people actually chiming in saying, yeah, we're in the same boat.
Yeah,
common.
and
yeah, pretty common. Yeah.
And I don't know if Elisa wants to comment on that too, because there was a lot of discussion at CHIME around this complete EHR and the need to possess all the technology. ONC has said that they are going to reevaluate that, but we haven't heard anything new. So as of now, in order to use any of the technology with that complete EHR, you have to, quote unquote, possess all of the technology that they brought forward.
Right. Makes sense. Let's see here. I am developing an EHR to use in my clinic. Where would I get a detailed list of criteria in developing this EHR?
Again, you could go out to the NIST test site that gives you all of the certifying test technology, or on April 18th, the each for EP will be available. But if you wanted to do some preparation, you could go out to the NIST test site.
Yeah, and that link was, I think, in your PowerPoint too.
Yes. And again, remember that you have to possess technology to meet all of the criteria, even if you're not going to use all of it to meet the meaningful use components, because you're not required to.
Right. And we've actually had a number of people ask how much.
How much?
Yeah.
Oh, for the EACH program?
Yeah.
Is that the question?
I believe so, yeah. Well, they've phrased it 3 or 4 different ways, but I believe that's the question at hand.
Okay. So again, it depends. It depends on how many pieces of criteria you're bringing forward. The minimum price is $7,000 because that's what we charge to certify the security technology. And then for the hospital, full EHR certification is of $32,500. Now, when you come through the EACH program, there is a fee for that, but we deduct that from the certification fee when you bring your technology forward for actual certification.
Right, right. Speaking of cost, I guess, so a question that, there are a number of certifying bodies available. What are the advantages of the EACH and CCHIT program for certifying?
Well, I'm not aware of any other body that has developed a program like the EACH program with the self-learning tools, the online community, and the weekly webinars to assist organizations in getting through the process.
It's pretty robust, absolutely.
Yeah.
Right.
Elisa, do you want to add anything to that?
I think I'd just build on that and say probably the way we differentiate ourselves is that we're healthcare people, and that we really have invested in tools to help you prepare and be successful. We don't want anyone to come and test and have to pay to test again because they weren't ready. So you have access to, our people who are clinicians, former CIOs, HIM professionals, people that have worked in healthcare consulting or worked with vendors and software development. Those are the folks that are behind EACH and helping people get ready to do the testing. It's mostly just that we're healthcare people, and we've been doing EHR testing, as I said, since 2006.
Really from the start of the whole process, really.
We really pioneered
exactly.
activities here.
Well, I think I've covered everything. We had a couple of other questions that came in where actually they mentioned specific vendor names, and I asked those attendees to actually contact you guys offline since they were specifically about specific vendors. And so I appreciate your time. This has been incredibly informative. We will make the recording of this presentation and the slides with the links to all of those in attendees, as well as all of our members. Please contact, if you want to go back to your contact slide with your email addresses. Please reach out to Elisa and Pat directly, especially for those of you. Again, we had a number of people chatting questions related to specific EHR vendors. So please speak with Elisa and Pat offline. They're there to help with a wonderful program, obviously, and a terrific organization. Thank you so much for your time. We appreciate your help, and I hope everybody has a great day.
Thanks, Carol, and thanks everyone for showing up today.
You guys take care.
All right.
Bye-bye.